We're living in a new age when it comes to baby making. Women who decide to have children later in life are increasingly using other women's eggs to get pregnant, and others are freezing their own for the future. Dr. Sanjay Gupta takes a closer look.
Well, Suzanne, sperm donation has been around since the 1960s, but surrogacy and egg donation, they're relatively new. So for most couples, egg donation meant finding a donor ready to start the process to harvest fresh eggs, while also stimulating the female partner to carry the baby. But now with this new egg freezing process called vitrification, that's the freezing of the eggs without the crystallizing of ice, it makes the eggs much more stable, and therefore reproductive specialists are able to store donor eggs. I wanted to show you what this all means for one couple who was struggling. They had something known specifically as secondary infertility, the inability to carry pregnancy to term, even though they've had the birth of one or more children in the past. Take a look.
Okay.
Michelle and Mike Herring now have the family they always wanted, but it wasn't easy. At 30, she had to use hormone therapy to get pregnant. The result was their son Levi, who's now 7 years old.
Yeah.
2 years later, they again had a hard time conceiving a second child. So they tried hormone therapy and IVF, in vitro fertilization.
By the third time, I sort of knew, okay, it was stressful.
But after rounds of unsuccessful treatments, she learned she had premature ovarian failure. She couldn't produce any viable eggs, so she chose to use an egg donor. And May was born.
It was just an emotionally taxing journey. I knew that one day I would look back and forget the struggle. And I did. It's hard for me to think about it now. But we have a wonderful family, and I can't imagine it being any other way.
The decision to use sperm or egg donation is a personal one. Embryologist Dr. Peter Nagy says it's often the best solution, since donor egg and sperm can offer higher success rates.
Donor eggs are coming from women who are donating, and those women are typically somewhere around 21 to 28, 29 years old.
So a 40-year-old woman says, I'm not making eggs, good quality eggs anymore, so I'll take a donor egg.
Correct.
From a 25-year-old woman. Has that 25-year-old woman's genetic material.
Correct.
And you combine it with sperm from
her husband,
the person's partner. Is this something that happens a lot, or?
Oh yes, absolutely. Here in the United States, about 10 to 15% of all IVF cycles is cycles involving egg donation. So
10 to 15%?
Yes.
Reproductive specialist Dr. Mitchell-Leef says more and more families are choosing this route to have a family.
They have a baby picture they can choose from, and they also know most of their background history, what their genetic makeup is, their interests, maybe their education.
They get to choose their eggs.
And they get to choose them, yes.
How much does that process cost?
It is $16,500, and that includes everything.
If a woman in her mid-40s is pregnant, has a baby, is it almost assumed that that woman had an egg donor?
I think I had 5 women overall in 30 years that got a pregnancy at 45 with their own eggs. That's not a lot.
Michelle and Mike say they plan to share their conception stories with both of their children.
It needs to be okay to and not be looked at as some weird thing to use alternate method, non-traditional ways to have a family.
If we're describing it in 10 years, hopefully it's like describing, a visit to the doctor, that it's become so prevalent that the stigma's gone. So that'll help too. It's nothing we've worried about.
And I should point out, Suzanne, the doctors that we met with said they've been able to achieve around 66% pregnancy rate from frozen eggs. This is pretty remarkable. In fact, it's right around the same percentage they've had with the fresh cycles they were doing before. So that makes this process cheaper and also more successful for those waiting to use donor eggs.